Mrs. Kissel is a lovely 90-year-old lady who volunteers at the local library and was having symptoms of severe aortic stenosis, mainly fatigue and shortness of breath.
For several years, she'd complain of shortness of breath, getting dizzy, feeling like she was going to pass out. I did send her and have her have some heart tests done, not at Strand. They said her heart was fine.
It was a Sunday before Christmas. I was reading the newspaper, and then I got up to get some paper or something, came back, and kind of a little woozy, and all of a sudden, my heart had stopped, and I had fallen down onto the ground.
And I found her passed out on the floor. She never even put her hands down. She just went flat onto her back. She had no pulse. She wasn't breathing. I called 911, gave her some quick breaths to try to start CPR, and I got her to come to. And then the ambulance came in.
They got me to the hospital, Strand Hospital, and the heart center that they have there. And while I was there, they took everything, EKG and every kind of x-ray and everything.
We happened to find that her aortic valve was severely diseased and ultimately needed to be replaced.
It doesn't open and close correctly, so that would cause me to be short of breath a lot.
Her case was a little unique, in that she's 90 years old, which is a little older than we would typically consider for a surgical valve replacement.
A 90-year-old has a tough time recovering from conventional surgery, so I thought she was high risk for conventional surgery.
We actually did discuss that at 90 years old, to crack her chest open and do open heart surgery. We didn't know she could survive that.
Fortunately, now we have transcatheter options that are much less invasive, much shorter recovery time.
TAVR is the best option for somebody like that.
And that would be going through the artery in her groin and up into the heart, repairing it and coming back out. So this was the perfect solution.
They had two cardiologists come in and talk to me, Dr. Stahl and Dr. Hadstat. And they discussed that this would be the best procedure for me to go with.
The day of the surgery, we brought her in early in the morning.
I went in with no worries because they made it all sound, well, that's not too bad.
My brother and I waited, and it seemed like it was maybe an hour and a half. The doctors were out saying everything was fine. She's going to be ready to go back to the room. She's coming out of recovery. And when we went to see her, she was fine. She was talking. She wasn't sick because she does get very nauseous from the anesthesia. She wasn't sick. She said there was no pain, tiniest incision, and it was done.
I was fine after that.
This was a great option for her. She tolerated the procedure very well, was in the hospital for 2 days and did great.
The doctors couldn't have been better, anesthesiologists, and the nurses all are wonderful.
What a relief. If they didn't find that at Strand, I don't think she'd be here today.
I just happened to be luckily that I was living here and it was available.
She had a doctor's appointment 3 weeks after the surgery or less. And her first question to the doctor was, when can I drive? He said, yeah, go drive. He said, yeah, are you having trouble breathing? No. Are you dizzy? No. Drive. She said, can I go back to work? Yes, she can go back to work. So this makes her happy. She has to be constantly busy.
It's wonderful to know that I can take off. If I want to go shopping, I can take off. I can go. I want to go and have lunch. I call someone up. Let's meet. Okay.
Bernice is back to where she was before any of this started. She can do everything that she used to be able to do, if not a little more.
We expect her to feel better, have less shortness of breath, more energy.
So the sky's the limit for her.
I would recommend the TAVR. If you are a person who is short of breath like that, then this is the way to go.
It was an easy procedure and obviously a very effective procedure.
It adds a little to your life. So now maybe I've got a couple more years left.